Hi, I'm Sharon Davis. I'm a certified nurse midwife and women's health provider for the Veranda. We are here to help you with your gynecological needs. I'm here today to talk to you about birth control. Well, the first thing we do is get a health assessment where we do an interview and find out what their needs are and what their health problems are, because each birth control has different ways of working. So we need to find out what the patient likes and what the patient needs and what her health history is. The options, we go through all the options, the combined oral contraceptives, the progestin-only methods, the intrauterine devices, the implants, things like that, and kind of customize that to the patient depending on what their history is. For example, someone with a history of blood clots is not a candidate for combined oral contraceptive. So we would choose something else, perhaps an IUD without any hormone in it. We basically listen to what they tell us about their lives and their lifestyles. You know, if they're a busy college student or if they're never in the same place at the same time every day, that plays into whether we give them a pill that they need to remember to take every day or whether we give them something that they can spend less time thinking about. We have a lot of clients who want to use oral contraceptives, particularly the combined with estrogen and progesterone, to try to regulate their cycles. People who have long periods, heavy periods, painful periods, we can improve those cycles often by starting them on a low-dose pill. And you have the benefit of having cycle control and birth control at the same time. Generic prescriptions are going to be usually more affordable. There are some prescription medications that are not generic, that have some cards that you can activate, some kind of promotional things that will make them more reasonable. And then, you know, you have to consider kind of the longevity of the device. If you're using an IUD, for example, that lasts maybe 5 years, you divide that cost out, and even though it's an expensive upfront device, over the course of time, it actually may be cheaper than taking a birth control pill. There will be patients that it's contraindicated, people who have a uterine anomaly, someone who has a history of multiple partners or sexually transmitted infections, pelvic inflammatory disease. Some of those patients would not be candidates for an IUD. But there are a lot of people who are, and they don't often know a lot about them, so we do some education. That's during the session where we do contraceptive counseling. They get education so that they know what their device can do, what it won't do, side effects, risk, benefits, and all of that.